Hello, my name is Kelly Fall, and I'm going to educate you on HIV and AIDS. What are the causes of HIV and AIDS? There are two strands of the human immunodeficiency virus, HIV-1 and HIV-2, which fall into the family of retroviruses. HIV-1 is the most common virus, whereas HIV-2 is concentrated mostly in West Africa. If HIV is contracted, the virus implants its genetic material into human DNA cells, which infects a person for life. It is incurable. It also depletes a person's CD4 cells, which are white blood cells that help battle diseases. Both viruses closely resemble the simian immunodeficiency virus, or the SIV, which is commonly found in monkeys and apes. Therefore, HIV is said to have been passed to humans by blood through the slaughtering and consuming of bushmeat of monkeys and apes, a common practice in Africa. HIV-infected people with a CD4 count of less than 200 are those that contract an opportunistic infection such as pneumocystis pneumonia, cytomegalovirus, tuberculosis, or toxoplasmosis, are all in danger of catching AIDS. How are these diseases transmitted? HIV is transmitted through mucous membranes, cuts, or sores on the mouth or genitals. This means infected blood, semen, or vaginal secretions must enter the body. This can happen through unprotected oral, anal, or vaginal sex, blood transfusions, sharing needles, or from mother to child during birth or breastfeeding if the mother is not being treated. Who is at risk for HIV and AIDS? People are at higher risk of contracting the disease if they have unprotected sex, already have another sexually transmitted disease, as some of these produce sores, which are gateways for HIV, use drugs that require injection or the sharing of needles. There are also groups of people that HIV and AIDS is more common in. Those most affected by this disease include gays, bisexuals, and men who have sex with other men, African Americans, and Hispanics. What are the symptoms of HIV and AIDS? Within the first couple of months of infection, most people experience flu-like symptoms such as fever, sore and achy muscles, rash, headache, sore throat, mouth or genital ulcers, joint pain, night sweats, swelling of the lymph nodes in the neck, and diarrhea. AIDS occurs when your immune system is nearly depleted. At this time, you are subject to becoming ill from opportunistic infections. Symptoms of these include fatigue, blurred vision, rashes, weight loss, cough, shortness of breath, headache, extreme night sweats, high fever, and white spots or lesions of the mouth. How can I prevent HIV? Use protection such as condoms during oral, anal, and vaginal sex. Don't use drugs that require the use of needles, but if you do, use a clean syringe and do not share. Find out if your partner has HIV or AIDS before you have sex with them. If you have multiple partners, make sure you and all of your partners get tested regularly. People at high risk for infection can be prescribed pre-exposure prophylaxis, or PrEP, which reduces the risk for contracting HIV. If possible exposure is suspected, a person can be prescribed post-exposure prophylaxis, or PEP, to reduce the risk for contracting HIV. You must notify your doctor immediately after possible infection for this drug to be more accurate. Treatment. Before you are prescribed medication, your doctor will run a few tests on you. These tests will show your CD4 count, viral load, which is the amount of virus in your blood, and drug resistance, which determines the strand of HIV. These tests will determine what you will be prescribed. A few of these medications disable the virus's ability to clone itself. These include non-nucleoside reverse transcriptase inhibitors, nucleoside reverse transcriptase inhibitors, and protease inhibitors. A couple of these medications block the virus from penetrating the CD4 cells, such as entry or fusion inhibitors and integrase inhibitors. A combination of these drugs is required to reduce immunity. There are approximately 1,453 Lafayette residents living with HIV and 800 living with AIDS. there have been 948 HIV or AIDS deaths, including 10 pediatric cases in Acadiana. There are 18,664 Louisiana residents living with HIV and 10,380 living with AIDS. There has been 14,112 HIV or AIDS-related deaths, including 111 pediatric cases in Louisiana as a whole. There are approximately 1,144,500 U.S. residents living with HIV and AIDS, and about 15% of these do not know they are infected. Louisiana is nationally ranked 4th in the number of HIV and AIDS cases. Baton Rouge, Louisiana is ranked number 1 in the number of HIV cases among metropolitan areas, and New Orleans is ranked 5.